Hello, guys. Good evening. We're waiting a few more minutes for your classmates to join us, okay? Hello, guys. Do you hear me?
Yes, we do.
Okay, thank you, Risa. Well, I think we waited long enough, right? The coordinator told me that you all have 10 minutes to join the meetings, so we can start now. It's 11 minutes past 8. Okay, so let's begin. I'm going to start sharing my screen. There you go. You can see it, right? Mm, Okay. Okay, guys. Good evening. Um, the coordinator told me that sent you an infographic about the topics that we are going to discuss all over the course, right? And there you can see that parts of the body is divided into two main parts, right? The last one we had the first part of this topic on Wednesday, and today we're having the second part of of this topic, right? And the third class would be about functions of the body. However, since today we're talking about parts of the body, and it is we are talking about deeper structures than the ones we saw we talked about on Wednesday, right? We're talking about deeper parts of the body today. So we're talking about some organs, okay? And we are also talking about their functions. So this will be a class that is actually two classes, okay? I'm going to relate them, the organs and their functions. Of course, we're describing the names of each organ, and we're going to divide them in these systems, okay? We're talking about, first of all, this, as you can see, is a lot of information. I know that you already have this knowledge because you are almost doctors. So today, we're going to talk about the cardiovascular system, the digestive system, and the reproductive system, mainly the female reproductive system, okay? So tomorrow we're going to discuss all the other four that are on your right. Okay, so we're talking about today about the heart and vessels, which are arteries and veins, the digestive system, which corresponds to mouth, esophagus, stomach, intestine, liver, and gallbladder, and the reproductive system, mainly the female reproductive system, as I told you, the uterus, the ovaries, the fallopian tubes, and the vagina. So let's get started. So here on your screen, you have some structures related to the heart anatomy, right? I know that you already know this because this is a freshman year topic, right, in anatomy class. However, I want you to pay attention to the pronunciation. And yeah, that would be it, okay? Here we have the superior vena cava. That is the correct pronunciation, okay? Superior vena cava, this one, right? Then we have the inferior vena cava. Wait a second. Mm, Okay, so here we have the superior vena cava, the inferior vena cava, that, develop the deoxygenated blood to the right atrium, right? Then we have the tricuspid valve. Then we have the right ventricle. Then we have the pulmonary valve. Then we have the main pulmonary artery. Then, as you know, it divides into two pulmonary arteries, the left and the right ones. Well, then we have the pulmonary veins, the left atrium, the mitral valve. Then we have the left ventricle. Then we have the aortic valve, and then the aorta, right? So you already know this, and I want you to ask if there's any question about the pronunciation of these structures, because that would be it, right? You know all this, so is there any doubt about the pronunciation? Anybody? Piece of cake, right? So let's go on. So we're going to talk about, oh, first of all, from today's classes on, we're going to have a lot of more participation from you guys. So those who participate will have extra points. Okay, that's how I'm going to add some points to your final scores. Uh, why am I doing this? Because only some of you participate a lot, and some others just participate when I ask them to. Okay, so I'm going to make questions to the end of class. There are going to be some questions, and if anybody answers correctly, of course, I'm going to add extra points. I already have another document to take notes of it. Okay, so let's go on. So we're going to talk about the cardiovascular system, aka the circulatory system. Here's the first question. What does this mean? AKA. Anybody, guys? This is a expression that
Also
is
known
Also known
as,
as
okay.
also known as.
Yeah, two people answered yes. So I since two girls just talked, I didn't get your name. So can you give me your name so I can take notes of your extra points?
Danitza Burgoa.
and Mariana Sanguines.
Okay, guys, you have your first extra points. Okay, let's go on. You can see the slides, right?
Yes.
Okay, thank you. Okay, so the main function of the heart is to pump blood, right? And well, the heart pumps blood through some vessels. These vessels, as you know, are the arteries and the veins, right? So mm, what the pump, well, the heart pumps blood through the arteries to the rest of the body, and the deoxygenated blood goes back to the heart through the veins, right? You already know this. So here we have the serous pericardium. Here we have, well, it has two layers, okay? The parietal layer and the visceral layer. The parietal layer is related to the fibrous pericardium, okay? And the visceral layer is related to the surface of the heart itself. These two main structures form the epicardium, right? Between the parietal layer and the visceral layer, there's a space in which, well, there is a protein that lubricates both surfaces, right? So this is a sac of fluid that helps with the mechanics of the heart. So deeper inside the heart, well, the layers that we talked about, here the epicardium, right? We have right underneath that, we have the muscular part of the heart, which is the myocardium, right? Which is the muscular layer of the heart. It has well, it has, of course, muscle cardiac cells, and it also has connective tissue, mainly collagen, right? It gives support to the muscle cells. And then we have an interior layer, which is the endocardium, that is only it's the same as the endothelium, which is the inner layer of the vessels, mainly arteries, right? And so you have, I'm sure you have heard of infectious endocarditis, right? There is a similar process. Well, it is a similar process, but as you know, the infectious endocarditis happens here, right? On the cardium. But as I told you, it is the same as the endothelium in your vessels. So when the infection reaches the endothelium, not the endocardium, the endothelium, it has a name. This disease has a name, the same as the infectious endocarditis, but involving the endothelium of vessels. So an infection of the endothelium. Does anybody know what it is? Okay, that's homework for you guys, okay? It is a related process. Okay, so let's go to the next slide. Where here we see well, this is like the beginning so far the cardiac cycle, right? Here we have the deoxygenated blood that goes through both superior vena cava and the inferior vena cava. It reaches the the right atrium, and it also, here's a little hole right here, which is the coronary sinus that has conducts blood from the coronary veins, which is venous circulation from the heart itself, towards the right atrium. It also happens in the right heart, right, in the right part of the heart. And it goes on to this structure. This blood passes through the tricuspid valve, right? You also know that it has 3 flaps or cusps. Notice pronunciation, guys. I know that you already know this. It also has chordatendinia. Okay, that is the name of this structures. You already know this, and they connect to the papillary muscles, right? Which are in the wall of the heart itself. What happens next? Well, the deoxygenated blood goes through the pulmonary valve. That it also has 3 cusps. However, it does not have chordatendinia, and then goes to the pulmonary artery. And as you know, it divides into 2 main branches, which are the right and the left pulmonary arteries. What happens next? Well, the pulmonary arteries divide themselves, and then the next vessels are called arterioli, okay? And the smallest vessels are the capillary, right? You also know this. It has a lot of carbon dioxide, right? When it reaches the lungs, and this is the alveolus. When you were talking in plural, we call alveoli, okay? So the carbon dioxide passes from the capillary to the alveolus, and the oxygen goes from the alveolus to the capillary, right? That is when it becomes an oxygenated blood and makes blood take this bright red, right? This process, as you know, is called hematosis. So Here we have a red blood cell that has millions of hemoglobin molecules. Each one can carry 4 molecules of oxygen. Well, then it goes to the pulmonary veins, and this oxygenated blood goes to the next step, which is the left atrium, right? So, what is the pulmonary circulation? When it goes through the pulmonary, well, from, yes, the pulmonary veins to the pulmonary arteries, to the lungs, and then it goes back through the pulmonary veins, right? That is the pulmonary circulation. Then when it reaches the left atrium, it goes through the other atrioventricular valve, which is the mitral valve, right? It only has 2 cusps, the anterior and posterior, as you might remember from anatomy class. It does have cordia tendinia. Here's a question, of course, an English question, okay? Uh, it's correct when I say it has 2 cusps, and that is correct, right? But what is the main difference between this sentence, that is, it has 2 cusps? What is the difference from this sentence that I'm going to make? It does have 2 cusps.
It's plural.
Nope, both are plural, right? I mean, we're talking here about the mitral valve, right? That it has 2 cusps. This is the sentence. The mitral valve has 2 cusps. And the other sentence is the mitral valve does have 2 cusps. Anybody else, guys? This is an English question. Nope. Okay. When I say the mitral valve has 2 cusps, right? It is a correct sentence, right? And when I'm saying, well, it means that it has 2 valves, right? And the other sentence is the mitral valve does have 2 valves. This is also correct. The main difference is the word does, right? When I'm saying does have, I'm trying to emphasize something. Okay, so why did I say it does have 2 cusps? We're talking about this atrioventricular valve, right? I'm talking about, well, I think 2 or 3 slides back, we talked about the other atrioventricular valve, right? So I'm saying does have to give it more importance in the next information. Do you get it? It does have 2 valves. When I say it does have, I'm trying to emphasize something. Okay, did you get it?
Yes.
Okay, that is the main difference. Okay, they are both correct. However, it does have. When I'm saying it does have, I'm trying to emphasize something. Okay, so let's go on. Here we have also when it has 2 cusps, right? Then it has the cordia tendinia and the papillary muscles. As all of the valves, it prevents backflow, right? Prevents the blood inside the left atrium to go back to the left atrium. So what is the next step? Well, it goes through the aortic valve that it also has 3 cusps. However, they do not have cordia tendinia, right? Since they do not have also, well, either the muscle, the papillary muscle. And it goes to the aorta, right? And it well, they divide into branches, right? Which are also smaller, the arteriales and the capillaries, as we talked about before. When it reaches the peripheral organs and tissues, they well um, the red blood cells deliver this oxygen to the cells, to the peripheral cells, and they pick up the carbon dioxide, right? These veins come together, make bigger veins, venules, then turn to veins, and then go back through the superior and inferior vena cava. And it completes the whole uh, cycle of the heart, right? You all know this. Mm, okay, so let's go on. Since we're talking also about the functions of the heart, we have to mention it. Well, the heart has two main functions, right? The systolic and the diastolic functions. So here we have a lot of information, which if you pay attention and if you read about it, it makes a lot of sense. So here we have some volumes, and we're talking here, when we talk about volume, we're talking about the systolic function, okay? So here we have the end diastolic volume. What it is, this is the volume of blood inside the left ventricle at the end of the systole, okay? I'm sorry, it is the diastole, right? It is, well, it is the volume of blood that is inside the left ventricle at the end of the diastole, okay? It goes from 80 to 150 milliliters. It is a medium of 100 milliliters, okay? So the left ventricle at the end of the diastole has inside of it 100 milliliters. What is, this, you read about it. I'm sure you read about this in Spanish. This is the volumen telediastólico, right? Then we have the stroke volume. I'm sure you read about this also. Can anybody tell me in Spanish what is the term for this stroke volume? Come on, guys, in Spanish. What is the stroke volume in Spanish?
It would be
Sorry?
Volumen sistólico,
Okay, yes, that would be it. This is also known as débito sistólico, right? The volume of blood that is ejected in one heartbeat, right? Who gave me the answer?
Mi, Valeria Guerra.
Okay, I'm going to write it down. Okay, Valerie, thank you. So from these 100 milliliters, 60 of them are going ejected, right? In one heartbeat. So the remaining of this, if you have the mathematical procedure, 100 minus 60 is 40, right? This volume is the end systolic volume, which is the volume of blood inside the left ventricle after the heartbeat, right? So that would be it. And here's the formula, right? On your right. So we have the end diastolic volume minus the stroke volume. Okay, easy, right? It makes a lot of sense. So next, of course, you all know this. The heart rate, the normal heart rate goes between 60 and 100, right? So what it is, this is the number of beats in a unit of time, which is in 1 minute. Okay, so if we multiply this, for example, 70, right, which is in the middle, we multiply this by the amount of blood that is ejected in one heartbeat, we're going to get the cardiac output, right? So for example, as the stroke volume would be, for example, 70, okay, which is between the normal ranges. So we multiply 70 times 70, which also is a normal range of the heart rate. It would be 4.9 liters, right? So that means the cardiac output the normal cardiac output would be between 4.5 and 6.5 liters per minute. So what is the cardiac output? It would be the volume of blood sent off in a unit of time, right? That is piece of cake. You also know this. Here we have, on your right, we have the formula of the cardiac output, right? Which is the stroke volume, which is right here, the second one, right? And we multiply this by the heart rate, and then we have the cardiac output. Okay, piece of cake, right? So, what is the ejection fraction? Is the percentage of the end diastolic volume that is sent off in one heartbeat. Okay, from this, what was the normal volume of the volume, then and diastolic volume? It is 100 milliliters, right? So from this normal ranges, 100 milliliters, 50 to 70% would be normal to be sent off in one heartbeat, right? So we have, here we have the formula, which is the diastolic volume multiplied by the stroke volume and all divided by 100 because we want to have the percentage, right? So here in heart failure, an ejection fraction lower than 50% determines a reduced fraction heart failure, right? Which is one of the main, well, when you have an echocardiogram, right? It determines how much of this volume is sent off in one heartbeat. So you can also classify this heart failure when you take into account the ejection fraction, right? You also know this. And we are talking about diastolic function. We talk about pressures. Okay, here we have the end diastolic pressure, which is from 8 to 12 mercury millimeters, and it is the pressure inside the left ventricle of the end of the diastole. Here's a little mistake. So we're going on to the digestive system. Okay, does anybody have a question mainly about pronunciation, all this stuff? Okay.
Maybe
Yes.
the válvulas.
Okay.
We can repeat
The
it one more
valves.
time. The valves.
Okay, let's go through them again. Okay, Um, okay, so we have two kinds of valves, right? We have the atrioventricular valves and the sinus valves, right? Both atrioventricular valves are on the right, the tricuspid valve, tricuspid valve, okay? And on the left, we have the mitral valve, okay? Tricuspid and mitral valves. That would be it. And the sinus valves are also two, right? The pulmonary on your right and on your left, the aortic. Notice the pronunciation, mainly about the second one, right? The aortic. It's like the T is silent, okay? Aortic valve.
Thank you.
You're welcome. Okay, so does anybody have any other question? Okay, so let's go on to the second system that we're going to talk about today, which is the digestive system. Okay, so there's a lot of structures here related to the digestive system. I'm going to name them. Of course, you all know this. So any question about pronunciation, if necessary, I'm going to answer. Okay, and of course, don't be afraid to ask. Any kind of gland is just like that, gland. It's not an A, it's not like it's gland. It's between an A and an E, okay, gland. Okay, so here we have the parotid gland, sublingual gland, submandibular gland. Okay, here we have the mouth. It is also related to the tongue. Okay, then we have the esophagus, the stomach, the well, here are the intestines, right? In the intestines, we have the the large intestine, which is the colon, okay? And the colon is mainly known as large intestine. And this one is called the small intestine. Okay, so in order, we have the stomach, the small intestine, which has also its portions that we're going to talk about later on. Then we have the large intestine, okay? The rectum and anus. We have some more structures that are related. Here we have the liver, the gallbladder. Notice the pronunciation, it's not an A, it's gallbladder. It's between an A and an O, gallbladder, okay? This would be it. We're talking about the bile ducts later on. Okay, so here we have the gallbladder. Here we have the cystic duct, the hepatic duct, right? And we're going to talk about later on, as I told you. Here we have the pancreas, right? Here we have the pancreas, and well, I think that would be it because the other structures, well, mainly the intestines, we're going to talk about later on. So, since we're, oh, well, is there any question about the pronunciation of these structures? Because I know you all know this, we are here mainly for pronunciation, right? Anybody, any question? Okay, let's go on then. Well, as I told you, we're going to talk about also the functions of the body, right? So, the deglutition anatomy has many structures related to it, okay? So what are these structures? The tongue, you know, tongue, it's not an O, it's like between an O and an A. It's tongue, tongue. Then we have the soft palate. We already checked this on the first class, right? We have here we have the soft palate. Okay. Then we have the oropharynx. oropharynx, right? One part of the larynx related to the deglutition anatomy would be this one, this structure, right? The epiglottis. Then we have the upper esophageal sphincter, which is actually one muscle. Does anybody know what muscle is forms the upper esophageal sphincter? Gain extra points, guys. Does anybody know, even in Spanish, if you do not know the name of this muscle that is related to this sphincter, in English, you can tell me in Spanish. Anybody, guys? Okay, this muscle is the cricothyroid. Okay, the cricothyroid muscle in Spanish. El músculo cricotiroideo, right, forms the upper esophageal sphincter. Okay, so this is the other structure related to the deglutition of anatomy. Then we have the body of the esophagus, and then we have the lower esophageal sphincter, right, which is formed by a lot of structures, right? So the deglutition phases are three, mainly three. Here we have the cephalic, oropharyngeal, and esophageal. Okay. When we talk about the oropharyngeal phase of the deglutition, we have a voluntary part which is related to chewing. That's, well, I know that you all know this. What does chew mean? CHEW. It's a verb.
Masticar.
Masticar.
Okay, who just said that?
Mariana.
Okay, thank you, Mariana. I'm going to write down your extra points, okay? Give me 1 second, guys. Okay, thank you. So, and then we have an involuntary time of the oropharyngeal time, the phase, I'm sorry, and it is involved with the deglutition reflex, okay? Then we go on to the esophageal phase of the deglutition, and it is completely involuntary. Then we have how does it happen? It has, first of all, it has muscular relaxation from the lower muscles, right? And then it has muscular contraction of the upper muscles, right? So here we have this term, which is dysphagia, right? What does it mean? It is difficulty when swallowing, to swallow. Does anybody know what a swallow is?
Tragar.
You're right. What is your name?
Danitza Urbo.
Okay, Danita, your second extra point. Okay, so the difficulty when swallowing is this, as you know, this term, right? So when we relate this dysphagia, we can divide this term into oropharyngeal dysphagia and esophageal dysphagia. Okay, so what is it related to? When we're talking about oropharyngeal dysphagia, we're talking about the beginning of swallowing. So it uh, it is related to the upper structures of the deglutition right? The deglutition anatomy. So we have amygdalitis, some scar tissue from any surgical procedure, anything like that, and inner compression, outer compression, or even Senker diverticulus, right? Does anybody know where the Senker diverticulus is formed? Anybody, guys? Extra points. Come on.
In the throat?
Sorry?
In the throat.
Which anatomical part would be we talking about? It is actually related to the oropharynx, the posterior wall of the oropharynx. Okay, it has you know it the diverticulus is like it is related to some two main mechanisms, right? One is related to pressure, related to inner pressure, like there is a lot of pressure inside one of these organs, right? In this case, the oropharynx. And the other is related to like, imagine there is, for example, pulmonary cancer, okay? So it has a traction mechanism. This, when a tumor starts growing, it's like it pulls some structures that are around this tumor. Okay, so it pulls the whole structure. For example, here it will pull the body of the esophagus. Okay, so it has two main mechanisms. One is from increased pressure on the inside of the organ, and the other is related to traction, that an outer structure pulls another one. Okay, it is. These are the main mechanisms for the forming of the diverticulum. Okay, so so it divides into real and fake diverticulus. This one is related to higher, increased pressure inside the oropharynx, right? So it would be a fake diverticulus because it does not have all the layers of a real one. On the other hand, we would have like when another structure is pulling the first structure, we would have a real one, a real diverticulum, right? You all know this. So when we're talking about the oropharyngeal dysphagia, we're talking about some structures that are related to upper structures of the deglutition anatomy. And when we are talking about esophageal dysphagia, we're talking about primary esophageal motor diseases, e.g. achalasia, right? So we're going on to the next to the next slide that talks. Here we have a little mistake. This is oxyntic gland, which is in the stomach, right? Here we have the main cells that we're going to talk about are the parietal cells. Why are these the main ones that we're talking about? Because they make it's like they make this inner intragastric environment like acid, right? So here we have a lot of other cells. However, the most important ones are the parietal cells because they make the acid, right? So here we have a parietal cell, right? And here we have, well, how many stimulations does it have to activate this proton bump? Because it has a proton bump, right? So it has three main stimulations, okay? A nervous stimulation, which is acetylcholine, right? Then we have another, which is the histamine and the gastrin. So the parietal cells has receptors for acetylcholine, histamine, and gastrin, right? You all know this. Here we have another cell, which is also in an oxyntic gland, right? Which is the enterochromaffin-like cell. It takes its name to when we see it under the microscope. So it is similar to the enterochromaffin cells. This is enterochromaffin-like cell. What does like mean? It resembles to, right? So when we have these are the three main stimulations that it has to activate the proton pump, right? And it produces hydrogen and lowers the pH, right? So this is important because this way is how we're going to understand the mechanisms of some drugs that we tend to give to our patients. First of all, here we have the proton pump inhibitors, in Spanish, IBPs, right? Like omeprazole, yes, the most famous one. Then we could it's like we stop the enteric nervous system with surgery, and we're going to talk about later on. And the H2 inhibitors, right? Like ranitidine, right? Ranitidine and cimetidine, right? So when we give to our patient one, let's say ranitidine, we block this one, right? So this is one less stimulation that it will it does not stimulate the histamine, does not stimulate the parietal cell anymore, but we still have the two other stimulations, right? The gastrin and the nervous, which is the acetylcholine, right? And then we have, how do we cut this nervous stimulation? By surgery. In Spanish would be vagotomia, right? We cut this cranial nerve, the 10th cranial nerve. It does not develop acetylcholine to the parietal cell, and it has one less stimulation for the parietal cell. And then we have the proton pump inhibitor, which are the most effective ones, because here we're talking about omeprazole and something like that, yes. And so it blocks this this pump that it's the final process, right? Well, when the parietal cell activates, it produces hydrogen and lowers the pH, right? So when we give to our patient this proton pump inhibitor, we block the production of hydrogens. So this is why the proton pumps inhibitor are the most efficient medication for well, it is way better than surgery that only cuts one of them, one of the stimulations, which is the nervous stimulation. And it is more efficient than this kind of drug, the H2 inhibitors. Then we have the small intestine with its three main parts: duodenum, jejunum, ileum, right? You all know this. And then we have the large intestine here on your right. It has its main parts. Well, it is more resembling to talk about the appendix, the ascending colon, transverse colon, descending colon, sigmoid colon, the rectum, and the anus, right? Here we have the liver. It is divided by this ligament, which is the falciform ligament, into two main lobes, the right and the left lobe. And here we have the gallbladder, right? Here we have the cystic duct, the right and left hepatic ducts, which come from the liver. They come together and form the common hepatic duct, right? The common hepatic duct comes together with the cystic duct and form the bile duct, which drains to the duodenum, right? So I think we are on time. It's 9 o'clock. Does anybody have questions mainly about pronunciation of any of the structures that we just talked about? Okay, so on Wednesday, we're going to talk about, as you can see, about the respiratory system and all the others that I showed you before. So as just like the other classes, I'm going to show you the poll. Okay, so let me know when you're done. I'm going to start now. Okay, so let me know when you're done here, please, guys.
I already submitted.
Okay, thank you.
I'm done.
Okay, thank you, guys. I think, okay, all of you. Okay, guys, I think you all did it. Yeah. Okay, thank you, guys. Remember, tomorrow we have our practice class from what we just saw today. And since today is, well, we had this class, tomorrow, please read some diseases that are related to the structures that we talked about today. That's what we're going to practice with tomorrow, okay? Diseases related to the structures that we saw today. Okay, so does anybody have question? Okay, thank you, guys. I'll see you tomorrow. Have a good evening.
Bye.
Bye. Thank you.
Bye, doctor.